Alvin Kamara has officially been ruled out for the remainder of the game against the Buccaneers today after suffering an ankle injury. On the play that he was injured on, it looked like he was the victim of another one of these hip drop tackles, which unfortunately puts the ankle in a very awkward position and a mechanism that's very consistent with a high ankle sprain. And this is definitely a tough injury to watch because I know he's involved in a lot of fantasy championships, including my own. With today's video, we're going to go over the injury video. We're going to talk about the mechanism of injury and why this could predispose somebody to having a high ankle sprain. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. With my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy of the injuries as well as what that person should expect when moving forward in rehab. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself, like me, have Kamara in the fantasy championship today, let us know how you did. Did this make or break your season, or was it something that really wasn't that relevant for you? So we can see here on the injury video that as he's running, he once again is going to fall victim to another one of these hip drop tackles. And when this is happening, this is placing a lot of external rotation going through the foot and ankle. Here I have a model of the foot and ankle joint, and so it's important to say that the ankle is formed by two long bones coming down to form the top of it. The first one being the tibia, also known as the shin bone, is going to come down and form the inside, also known as the medial malleolus. Then as we go towards the outside, the fibula is going to come down to the lateral or outside portion and form that lateral malleolus. And then as we look on the inside here, we have a bone known as the talus, and these three bones together make up what we know as being the ankle joint. There are a number of ligaments and tissues that make up the overall stability of the ankle. For the sake of this video, it looks like, unfortunately, the mechanism is consistent with a high ankle sprain. So that's what I want to focus on first. The high ankle ligaments essentially are ligaments that are not located in the ankle joint itself. They are located slightly higher, which is why when they are victim to an injury, we call this a high ankle sprain. The first ligament is located right in through here. It's known as the anterior tibiofibular ligament. So anterior meaning it's on the front portion of the leg, tibiofibular because it's going to attach the tibia and fibula together. Then as we flip towards the back of the model here, we also have a posterior tibiofibular ligament. Posterior meaning on the back of the leg. Once again, tibiofibular meaning that it's going to attach the tibia and the fibula together. So anytime a person's foot is going to be planted into the ground and a lot of external rotation force is going through it, you can see here that as I do that on this model, it is going to try to separate the tibia and fibula, which is doing the exact opposite of what both of those ligaments are trying to do. So anytime you're getting any sort of separation force going through both of those ligaments or one of them, they are going to essentially predispose this person for a high ankle sprain. Another thing that's important to note here is that being in a lot of external rotation when it comes to the foot and ankle can also predispose somebody to have a fracture, whether that be at the fibula and or the tibia, and maybe even the talus. It depends on the amount of force. Usually a person cannot walk after this and they're going to be ruled out immediately because they're going to have an x-ray, but it's important to say that that's something else that absolutely needs to be ruled out in this case. Also, as we look on the injury video, it looks like that as he's going through external rotation, he's also getting what's known as an eversion motion going through the foot there. And anytime a person is going to go beyond their normal value of eversion, that's going to stress the structures located on the medial malleolus. And this is a group of ligaments known as the deltoid ligament. So this is something else that can also be essentially ruled out in this type of an injury. When it comes to the soft tissues, the gold standard here is going to be the MRI. And this brings me to the grading system of these ligament injuries. There are grades 1, 2, and 3. In a grade 1, this is where you're getting stretching of the affected ligament. In grade 2, this is where you're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. So if I had to make a guess right now as to what Kamara is dealing with, it looks like to unfortunately be very consistent with a high ankle sprain with risks of essentially potential fracture as well as deltoid ligament being involved as well. In order to accurately determine a person's timeline to their recovery, essentially what we need is we need to know the specific grade of the injury. So once I happen to see MRI results or any sort of imaging results, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So we wish Alvin Kamara the best of luck moving forward with this injury. We hope that it's more along the lines of a low-grade sprain and not anything involving a fracture or high grade, anything that could essentially cause surgery. And hopefully if you started Kamara in today's game, that did not affect your outcome, because it looks like it's going to affect mine, unfortunately. Once again, if you enjoy this content and you want to see more of it, I'm going to go ahead and link another one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thanks again for tuning in, and I'll see you next time.